For more, we're joined by the Shadow Minister for Indigenous Australians, Linda Burney, in Sydney. Good morning. Welcome to News Breakfast.
Good morning.
Could I ask you what you're able to tell us? Are there more details about this particular man, and have you heard of what else might be happening?
I have, and obviously there have been many deaths from COVID since the pandemic began. But as you say, and I very much recognise that, and as you say, there is the first death of Mr. Dunn in Dubbo 2 nights ago. He was a man in his 50s. His niece put a Facebook post up saying that the first time he met his grandnephew was the last time. He was not vaccinated, and obviously from a very prominent family in that area, hence the outpouring of grief that we're witnessing.
And I'm sorry for his family to hear of this news. When you're looking at the numbers, 750 people population in Wilcannia, you've got around 70 who are infected with COVID. What concerns do you have going forward?
Well, what I'm really concerned about is that you take a little place that you've just referenced, Lisa, Wilcannia. 10% of the population in Wilcannia has the infection. And then you add the close contacts. It is almost impossible for people to isolate in those communities because of the overcrowding in houses, because of the large families. I mean, some 3 and 4 bedroom homes have 16, 17 people living in them. And my understanding is that people who have been diagnosed with the virus are being sent to isolate, but going back into very overcrowded conditions. So obviously there is an urgent need for people to have the capacity to isolate. People should not have to set up tents in their front yards to comply. The other thing, of course, is, and this is very important, is that we've got 700 plus cases across the region. The government was warned on the 20th of March 2020 that this was an inevitability. And now what was predicted back then is actually happening. Of the cases that are in hospital, there are 330 as of yesterday, people who are at home, being home cared, whatever that means, with the disease. So my fear is that this will leak out of those communities and reach other vulnerable populations. There are lessons to be learned from what we're seeing in Sydney. I mean, I'm the member for Barton. 3 of the hotspot or the areas, LGA areas of focus, are in the electorate that I represent. We have to get a permit now to travel to work. And I'm not complaining about that because there are so many people that don't even have the capacity to be able to do that.
Linda Burney,
in Western New South Wales, this was preventable.
Right. I just wondered, what can be done right now to try and stave off what appears to be a growing crisis in Western New South Wales?
Vaccinate. Set up places for people to be able to isolate close to their communities, and please have a close look at the capacity of hospitals or lack of hospitals in some communities right across the region, the capacity of people working in those places, and boost that. And for heaven's sake, let the response be led by leaders in the community who know their communities, who know what the answers are, and have the capacity to help.
All right, Linda Burney, thanks for your time this morning.
Thank you so much.